Hi everyone, welcome back to our channel. Today, we're tackling a topic that's super common but often swept under the rug: constipation in children. Did you know that nearly 30% of children experience constipation at some point? It's way more prevalent than you might think. Stick around because in this video, I'm gonna break down everything you need to know about constipation in kids, from the causes and symptoms to practical tips for relief. Let's start with the basics. What exactly constipation in children? It's not just about not pooping enough. We also have to consider the consistency of the stool and the discomfort it causes. We're talking infrequent bowel movements, meaning less than 3 times a week. And those poops? They're usually hard, dry, and difficult to pass. Constipation can really take a toll on a child's overall well-being. When a child is constipated, it's not just about the physical discomfort. It can lead to stomach pain, bloating, and even cramping. Imagine trying to play, learn, and just enjoy being a kid when your tummy is constantly bothering you. Constipation can impact their appetite, sleep, and even their mood. It can really put a damper on their overall quality of life. Now that we understand how much constipation can impact a child, let's talk about it happens. One of the biggest factors is often diet. Not enough fiber, not enough fluids, too much processed food can all wreak havoc on a child's digestive system. But it's not just about what they're eating, it's also about their bathroom habits. Are they holding it in because they're too busy playing, or maybe they're afraid to use the bathroom at school? These are common behavioral factors. Toilet training can sometimes lead to constipation as they learn to control their bowel movements. Starting school, moving to a new home, even traveling can disrupt their routine and lead to digestive issues. In some cases, there might be underlying medical conditions that need to be addressed by a healthcare professional. How can you tell if your child is constipated? That's where your parental detective skills come in. It's all about paying attention to the signs and recognizing when something's not quite right with their bowel movements. Early identification is key because the sooner you address constipation, the easier it is to manage and prevent it from becoming a chronic issue. What are some red flags to watch out for? First, a decrease in the frequency of bowel movements. If your child is going less than 3 times a week, it's time to take notice. Pay attention to the consistency of their stool. Are the poops hard, dry, and difficult to pass? And keep an eye out for any signs of discomfort like straining, crying, or even pain while trying to go. Don't worry, I'm not going to leave you hanging without some practical tips to help your little one find relief. Most cases of constipation can be managed with simple home remedies and lifestyle changes. One of the most effective strategies is to increase their fiber intake. Think fruits, vegetables, whole grains, all those good things we should be eating anyway. And just as important as fiber is hydration. Make sure your child is drinking plenty of water throughout the day. Beyond diet, there are a few other things you can do to help your child. Establishing a regular toilet routine can work wonders. Encourage them to sit on the toilet for a few minutes after meals, even if they don't feel the urge to go. This can help train their bodies to go at a consistent time. Physical activity helps stimulate bowel movements and keeps things moving along. Encourage your child to get moving, whether it's playing outside, dancing, or even just running around the house. While home remedies can be incredibly effective, there are times when it's crucial to seek professional medical help. If your child's constipation is severe, persistent, or accompanied by other concerning symptoms like fever, vomiting, blood in their stool, or unexplained weight loss, don't hesitate to reach out to your pediatrician. They can help determine the underlying cause and recommend the best course of treatment. Remember, every child is different. What works for one might not work for another. Your healthcare provider is your partner in your child's health and well-being. To wrap things up, remember that constipation in children is incredibly common and often easily treatable. By making simple changes to their diet, ensuring they're adequately hydrated, establishing a regular toilet routine, and encouraging physical activity, you can help your little one find relief. And remember, you don't have to navigate this alone. Reach out to your pediatrician if you have any concerns or questions. That's it for today's video. I hope you found it helpful and informative. Remember, you've got this, parents. Armed with the right information and a little bit of patience, you can help your child overcome constipation. If you enjoyed this video and found it useful, please give it a big thumbs up and subscribe to our channel for more informative content on all things health and parenting. Until next time, stay healthy and take care.